to improve data collection and response strategies. And finally, you're also going to get to learn about some practical applications of the survey technology, email actions, URL directs, redirects, all that kind of stuff to help streamline public health initiatives. So I'm really, really pleased to welcome our presenter today, Brandon Polinsky. I've seen him present with our Kansas group in the past, so I'm especially glad that he agreed to come talk with everyone here today. But Brandon serves as the Director of Innovation, Quality, and Informatics for the Toledo-Lucas County Health Department. He leads the efforts to uphold public health accreditation, and he oversees implementation of the agency's quality improvement, performance management, academic public health, epidemiology, emergency preparedness, and strategic planning endeavors. As if that wasn't enough, additionally, Brandon is presently facilitating the transition of Healthy Lucas County, or HLC, coalition operations under the stewardship of the Health Department. HLC engages key community stakeholders to conduct a community health assessment and develop a community health improvement plan every 3 years. Brandon earned his Bachelor's of Animal Science and Master's of Public Health in Veterinary Public Health Focus. Both degrees are from the Ohio State University. He has been trained by the Center for Public Health Practice at The Ohio State University as a performance management peer coach and is a graduate of the 22nd cohort of the Mid-America Regional Public Health Learning Institute's year-long fellowship designed to strengthen and promote each fellow's core leadership competencies and skill sets. Really excited to have you here, Brandon. Thank you so much. Oh, I see your mouth moving, but I cannot hear you.
Do you hear me now?
I sure can. Awesome. Thank you.
Okay. Wow. Glitch in the matrix there. My mic wasn't muted, but we're good to go. Hi, everybody. I'm going to walk through, as Taylor mentioned, the survey that we developed that actually came out of a quality improvement project. It wasn't our initial aim when we started the project, but we came together to look at a problem, and it ended up being one of the major tools that came out of it. So if you have questions along the way, I will probably answer those at the end because I probably won't see the chat, but otherwise I look forward to anything you want to know as we get started. So for those of you not from Ohio, just a quick overview. We are a decentralized state, meaning that we have 111 local health departments for our 88 counties and some cities, and then one state health department. In Lucas County, we are the 6th most populous county in the state, largest in our region. And just to give some context for some of our food operations that go on, this number changes depending on when licenses are renewed or started. But when I pulled the data, because I think it even changed after I did so, we had 2,811 food service operations or stores, restaurant stores, all of that. And per our Ohio Food Code, those required over 4,500 regular inspections, and those don't even count complaint inspections, which is really what the focus of our survey and all that was. So we have a lot of inspections to do to keep our residents healthy in the food space. How we do that is we have 13 food safety sanitarians, registered environmental health specialists. You may be familiar with both terms. I'll probably say both interchangeably. And we also have 3 infectious disease epidemiologists at our department and numerous clerks. We have 4 in our environmental health area and then clerks throughout our department. So I didn't list our total number there, but that is a brief overview of our jurisdiction in a nutshell. We got together because our clerks, our sanitarians, our epidemiologists realized there was a major communication problem. When food complaints would come in, whether for a facility condition, whether for a foodborne illness, they might go anywhere in our department, even to areas outside of environmental health and the epidemiology program. And nobody seemed to handle them completely consistently. Obviously, the closer you got to epi and the closer you got to environmental, they were handled a little more consistently. But even between those areas, there was definitely some communication barriers or just processes that we hadn't updated in a long while. So our problem opportunity statement was when they were received, they come in just about everywhere. There was no clear process for communication or how the follow-up should go. or when an epidemiology investigation may have to occur. That was something that our sanitarians voiced, that they weren't sure when to start a foodborne outbreak investigation. Some would just automatically start collecting samples, whether it was necessary or not of food. Some wouldn't be sure, and the timeliness of some of those processes was really impacted by that lack of core communication. Our aim statement in starting the project was to create and implement a defined operating procedure, um, and make sure that everything is consistently managed, related to outbreaks, related to food complaints, et cetera. You can see there our QI team was made up of a pretty good mix of different individuals, from the various areas, as they should be. Okay, jumping into just a couple of the aspects. This was our fishbone. We also did process maps, which I don't have displayed here, because they're very hard to follow in a slideshow usually. But across all these different areas where we looked at what the major issues were, we analyzed those and boiled those down then into our root causes. As I've kind of alluded to, internal communication, what constitutes an event versus a non-event, when does an outbreak procedure need to be followed, no standard information required for sanitarians to collect. Our EPIs didn't know when they might be getting information from them, et cetera. There are also very different complaint scenarios. We have a couple different systems in Ohio. So any disease report goes through the Ohio Disease Reporting System, or ODERS. Our sanitarians currently collect all of their, or write all of their inspection reports into HealthSpace. There was a major epiphany phase between the QI team when the sanitarians realized that the EPIs didn't have access to HealthSpace, because for a long while they were waiting for them to go in and close food complaints that were related to outbreaks, and our EPIs did not have access. So that was a really big barrier to like, oh, this can't happen this way. We need to change our process, because it's not ever going to work quite how they envisioned it. Um, and also, as far as the sanitarians for guidance, if depending on the disease agent that you're looking at, if something's making someone sick, you have very different food collection protocols, things that you're going to look at in the facility, et cetera. So we looked at all of those things as we worked through our process. Our overall project outcomes, and I'm reserving most of my time to go through the survey. That's why I'm kind of going through the QI aspect pretty quickly. We did some internal staff training, especially the clerks, especially the sanitarians during one of their food meetings. All of our EPIs were involved in the QI team, so they were pretty much developing the training, and we didn't necessarily do something individual with them. We updated our standard operating procedures. There's just the first page up in the corner up there. One of our sanitarians who was on the project team found a foodborne illness checklist, which we found to be very valuable and distributed to our staff. We modified only one or two fields. Most of it was good as is. And I apologize that I do not remember where they first found this. So I do not have the proper attribution. But for those of you who are in that space, who work in that, some of those abbreviations will instantly make sense to you. HH for hot holding. I'm not a sanitarian myself, so some of those are jargon to me as well. But this has proved very useful when our EPIs might now call one of our sanitarians saying, hey, we think there's a norovirus outbreak. This is what you need to look at. We think there's a Giardia outbreak, et cetera. And of course, the main thing that we're here to talk about today is the reporting survey that came out of this. So we first implemented this back in August 23. That was when our testing phase for the QI project started. To date, or at least as of the date of this presentation, we had 431 completed responses. We've actually had almost 800 people start the survey, but as I'll talk about a little later, not everybody puts information in. Some might just be exploring what it's about. So we have 431 that are actually full enough of information to follow up on our end. Of those 431, 279 were food facility complaints. We'll talk about that a little bit later. And 152 were related to possible foodborne illness complaints, whether it was an outbreak or just an individual saying a particular meal made them sick and they think it was this location. Before we get into the actual survey, I wanted to pull up some key considerations. Some of these will be very familiar to some of you, especially if you've been building surveys in Alchemer already. But some of these are things that you don't always think about when you're starting a survey. The first one is the encrypt response data. So under tools and survey settings, this is where that lives. And there are some drawbacks to using this and some positives. So if you absolutely are collecting sensitive information, Alchemer's platform is encrypted as at its base level, normal website encryption. But you would use this if you have especially sensitive data that you're collecting to add another layer of encryption to it. Now, one of the key aspects, and this is why this is one of the first questions you need to answer if your survey needs to be encrypted or not, is it can't be changed once you've collected any response information. Even a test response will make this, it'll lock it down. So you can just duplicate your survey if you were doing a test response, make a copy and then make and build off of that. But that's just an annoying step you can avoid if you know off the start whether this is a feature you need to enable or not. Now, enabling it does make some things incompatible. Like you can no longer share public reports for those who have dove into doing that. Essentially making kind of like a web dashboard from your survey. We didn't do that with this survey, so I won't be showing that today, but that is a major consideration. And then I listed some of the other things that are not compatible if you do choose to encrypt your data. So if you don't need it, you don't need to. There's still a base level of encryption on your survey. But if you are collecting more sensitive information, you should definitely encrypt and just know what you can and can't do. One quick aside is Alchemer has a wonderful help library. Um, I put the link to this particular issue if you were going to use encrypt or not. Googling Alchemer and any issue usually will get you where you need. They also have amazing customer support if you haven't had to use that. Okay, one of the next things is tools and response settings. File upload security. This is independent of encryption response data, and there's a good reason why you might not want to have this checked. I think in a lot of cases it's checked by default. In our case, in our survey, we allow respondents to upload images in one of the pathways so that they can directly show us what the issue is going on. If we had this enabled, then our clerical staff who do not all have Alchemer accounts would not be able to download those pictures to attach to the record. So that's a consideration, or if somebody had uploaded files, that's a consideration as well. Again, if you're doing sensitive information, because we definitely have Alchemer surveys that we use as secure file portals for our reporting entities, schools, long-term care, et cetera. You would want that on so that only someone with an Alchemer account password can get to them. But if you're doing a survey that's general like this, where you have other staff in the building who may not have an account but still need to get to that access, you would want to disable that. One of the things in Alchemer, even if you've used the platform and used and made your own surveys, that I don't know if this is a feature most people have explored yet, but it's called the custom group question. This is towards the bottom when you're selecting a question when you make a new one. And there are several advantages and disadvantages to this. We use custom group a lot in this particular survey, and one of the biggest advantages to it is if you are doing a survey that people are going to complete on mobile. The default form for Alchemer when you're doing a mobile survey is to show you a single question at a time, and then they answer it, and it goes to the next screen and shows them the next question. There's no vertical scrolling. I don't know about some of you. That would be very, very annoying to me to have one question spoon fed to me at a time. It would make the survey seem so much longer than it has to. So if you use a group question, it's exactly as it sounds. You can use almost any of the other question types, and you build them into what's essentially a shell. So you'd have a prompt that is your overall question, and then you can have individual question types below that. And what that does, especially on a mobile version of a survey, is it keeps all of those together. So if you had a contact me section or contact info section, or you're looking for all the restaurant information in a section in this case, they would have all those questions at once on their screen and they would have to scroll. But I think we're all used to that aspect of using a mobile device. And in our opinion, it definitely is a lot better. One other advantage to using custom group is you can have an option where you can repeat the whole group. So if you were collecting something that maybe someone needed to know, or we're giving you like, what strategic priorities do you think we might need? Do you have any other priorities to suggest? You could have you could enable, sorry, an option whereby they duplicate that whole section and fill it out differently the next time. There are a few questions that are not compatible when you do that, especially if you have any like grid questions, but it's really useful in that regard. Some of the disadvantages are more minor annoyances than actual true disadvantages when using this. One is if you want to make the questions required, you can do that all in one shot with a custom group. But if you have that one question in the middle that doesn't need to be required, or you don't want to force people to answer, you have to do it individually for each of those questions in the group, just like you would outside your survey. Um, Similarly, if you ever wanted to move a question out of the group, you can't do that. So you need to be mindful if you want to go that route or not, because once they're in the group, you have to remake the questions individually if you if you decide you don't want that. Another key feature that we use in this survey is the skip disqualify action. So as you can see from our buttons there, and you'll see this in the survey, sickness after eating or food facility condition, food safety, we set all of those sections up on different pages within our survey. So if they answer a particular, well, one of the two choices at the start of the survey, they're going to skip exactly to the page that they need that are related to that section. Because if someone wants to submit a food facility complaint, we don't want them to have to go through all the sickness after eating questions. It won't make sense. They'll never complete it. They'll get frustrated and just be a bad experience. So if you want to implement a survey like this, you definitely need to make friends with skip disqualify. And this goes between pages. So we have our first intro page, which you'll see. Then we have the skip disqualify action after it, which basically says if they answer that food facility condition, they're jumping to this almost the last page where those questions are. If not, then they'll proceed in the order that we have the current pages. Until they get to the end of the sickness after eating section, where we have another skip disqualify. So they skip over the food facility conditions and go to our thank you page. So you'll need that in a couple places if you ever want to jump around your survey for any reason. It's not too hard to set up. It's between the pages, just setting up an action, just like you add questions and so forth. Okay, a big thing too that can be very useful is a URL redirect. We use this on our thank you page, which you see below. Essentially, we made our thank you page with that message. We even included a direct link if they wanted to go submit another report, if they wanted to go directly to our food safety page on our website, or if they just happen to finish the survey, it will automatically redirect them there after 10 seconds. So again, this is a very simple thing to set up. You just tell it where you want it to go. You set the time frame, how quickly you want it to go there, and it'll do that as soon as they get to that page. All right. One of the things that really helped our communication when I talked about all those barriers and making sure that the correct individuals got the surveys that they needed to are send email actions. One of the first things is you're not limited to the number of, well, I don't know if you're limited, but I know you can at least do 3 different ones. I've done at least those in a survey. So you can have at least 3, probably up to infinite until you crash the system, send email actions. The ways that these can be useful, and I'll show you an example on the next slide, is you can have one email go to a certain department with a response or a certain subset of your questions where they need to go. You can have one go back to the user filling it out if you collected their email during the survey. And here we have it going to 3 different places, but all internal to us. We don't collect the user's email throughout the actual survey itself. Okay, time is good. What this looks like, and this is the one that goes to our epidemiology department. In the to field, we have our generic email. We also included, and we had our IT work with us, a digital fax that we have. It's our secure fax, and we have it send the response there as well, just to alert our EPIs because they're usually looking at that queue more than the generic general EPI email. Hey, you've got a new response you need to go look at, and then they would go to that email and access it. Something that I think is very useful to point out is you see in the body we have question value ID 84, ID 27, etc. You get those from that merge code button that's on that gray toolbar towards the bottom. And basically, you can have the email include the dynamic information answers that they did during the survey. And you can even put it in your subject line. You just need to figure out the merge code first, and then you can post it in your subject. So in the case of this, we have our foodborne illness survey differentiate whether it was a restaurant or a community event or a private function. So right away, just from the email subject, our EPIs know, oh, we have a new illness from a private function. Is it a wedding that something went wrong, or whatever it may be? So they have that context even before they look at it. Which, not that every complaint isn't urgent, but some are more urgent than others. One thing with this is you won't always want to do this, or it will make more sense sometimes than others, is we attach a PDF review, and I will show those after we go through the survey to our emails. That's under that same setup, the email send, but you go to the advanced tab and say, yes, do attach a PDF review. Now, two of the things that are going to make your life a little easier is if you check only include the questions that that survey taker saw and only include answered questions. And the reason that'll make it easier is, again, if they answered food facility complaints, you don't want to see all blank questions for foodborne illness in your PDF. It just makes it way easier on your staff or whoever has to actually parse through the information at that point. Okay, and with that, we will jump over to the actual survey. And can you confirm that you're seeing the web browser now?
Yes, looks good.
Perfect. So this is our foodborne survey. Just like you saw, we put images in our first question just to make it really quick and easy. People don't need to think. They don't need to read a lot of words. I'm personally really partial to the unhappy face on the plate. I just take delight in that particular image. But we'll walk through the shorter pathway first, which is food facility condition. So if they select that, next, we jump right to that page in our survey, and I'll go to the background behind it in a minute, but this is what they would see as a respondent. So we do give a warning at the front that saying, if you do not provide us enough information, we may not be able to investigate the complaint. This probably deters some people, even though we don't have the questions required. They can skip those. Most of them fill them in. Some do anonymous at whatever, or just type gibberish and then they put their actual complaint below. You won't see a red asterisk for required questions in this particular survey. I made a copy because I learned the last time I presented this that I don't want to type in every field as we're going through the survey as an example. So typically everything, I'll point out the ones that are not required, but these first three are not, and everything else in this section is. But essentially, what's the facility? What's the address? When did the issue occur? Give a best estimate about when. For those of you who have used any survey platform, you are probably familiar with validation. You can lock certain types of information. So this has to be a date format. We didn't do that with the time just because the way people write time can be so very different. But that's a consideration when you're doing these, is only be restrictive when you need to, because the more frustration you have, the less likely people are going to give you good usable data. We do have a primary complaint, and this goes into the email subject and body for our clerical staff and environmental, just like the EPI, the ones that goes to the EPIs. We used to have this detail different questions and sections, and then we simplified. So really, this is just for our knowledge of how we're receiving this information and what they feel the main issue is. We ask where in the facility they observed the problem. And then we ask for them to describe what they saw. We do throw in there, did you notify anyone at the facility? If they say no, that's that. If they say yes, we then ask them if the person they notified addressed it. And again, there's no further pathway after that, but it's interesting to see a lot of the times if they say, yes, we notified, no, they didn't do anything. Sometimes that's just perception. They may not be aware of them addressing it. Um, but it's data that we thought was definitely interesting to have. And then, of course, we have our optional, and we usually label in some of our surveys optional right up front. We didn't put it on the contact information for the section because we do want it. We're just not forcing them to give it. But down here we put optional, please attach up to 5 images. When you're using this type of upload in Alchemer, you can actually specify the total number that they're allowed. You can specify the total file size up to, I think, 25 megabytes per. Um, and then that's what they will have to use, or rather, that's what they can upload. So I'm going to go backwards now, and we're going to do sickness after eating. So when we go down this pathway, there is a lot more information that we actually collect. And there's a caveat to that because the more you collect, the more pages you have, the more likely they aren't going to give a complete survey. So it did introduce something we have to do on top of just collecting the information. But our first question, other than saying, again, if you don't provide enough information, we may not be able to investigate the illness. We ask them, are they applying for themselves or another person? If they do say another person, we have this a nice little section that pops up. Are they the legal guardian? Are they a minor? Your name and number. Do you live in the same household or apartment? Because individuals may report for someone they know, especially parents, if they no longer live with their children. Um, and that just helps our epi know exactly what they're getting into before the investigation even starts. I'll do myself just to hide that section. We get in then to information about who is sick. So the basic information you'd expect, and most of this is the starter information we would need to create a file in the Ohio Disease Reporting System. So even if it's a suspect, if we're entering, this is the minimum number of things we need to typically collect even to make a proper file. Sex, phone number, address, etc. Something that's very important for exclusions is if they work in any of these occupations below, there are specific sensitive exclusions. In the state, I imagine most states have some of those exclusions in place, especially if they have a diarrheal disease. They're not supposed to be providing childcare, be a food handler for a couple weeks thereafter. So that helps the UPI know, okay, we have a sensitive occupation. They work in a long-term care. They work at a school. So we need to give this guidance right off the bat. And then, of course, we go down to the different pathways. So restaurant/food truck, grocery store, community event, private event. Most of our responses fall in the restaurant, food truck. Sometimes we've gotten community event or grocery store, but almost all of them are in the restaurant, food truck area. We do have, when we get to these community and private events, another subsection that's just to notify us. And I'll show that, but most of these sections have very similar questioning otherwise. So again, when we go there, we have the basic information you'd expect to collect, which restaurant, where was it at, because there are a million McDonald's and we want to know what intersection it was and not just that you ate at McDonald's somewhere in the county and we get to play guess where. The date they ate there, what did they eat with as much detail as possible, how many people also ate food at that location, and how many people got sick. For those of you who deal with infectious disease, you know that's pretty important to the definition of an outbreak or a potential outbreak is for most circumstances, 2 or more individuals who typically don't live together or shared a very common meal from a restaurant. And the question that I enjoy seeing the answer to, because it's almost always no, is did you eat anywhere else outside your home for 3 days? So most people say no because they really want to lean into that recency bias and say, nope, I definitely got sick because of the last place that I ate. Even though it was 2 hours ago and most foodborne illnesses take a lot longer to actually develop and impact you, it was definitely that place I ate 2 hours ago and not anywhere else that I might have eaten. So they typically say no. Moving on from there, we go into the actual illness information. Are you currently ill? If they say yes, they fill this out. If they say no, there's an extra date of when did your symptoms end? What symptoms did they have? How long do they typically last? And did you seek healthcare for this? Um, which helps us know if there might be another record for their illness in one of those other locations. After we follow that, we get back to our end page, which I'm going to go back to my slideshow to get to the link because there we go. Okay. And we will check a different one. Let's do a community event. So community event, similar line of questioning just to show the slight differences, event name, location. Um, this is one of the things that differ. So we also have food trucks here. We did add it. We didn't initially have it on that restaurant food trucks, but I think it started causing confusion. We started noting that. So we do have it here as well, but specifically, we're hoping people will answer. I don't know if we have enough data yet to say if they're using it properly because most of our things have been the first thing. But depending on what they answer, catered, which caterer, if you know, what did you have at the event, food trucks, which food trucks did you purchase from? We'll get a couple different questions. The last two are just please describe because they could be anything. And those are the only differences that fall there. Okay. So I won't make you sit through the 10 seconds of silence at the end. But like I said, the links are there. We could go right back to our food safety page where we do have our button to report it right at the top. And we'll go back to our slides. Okay. So one of the things I wanted to point out, if you have a long survey like this, or you have something that does have email actions, but someone may not have completed for any reason, you'll get these partial responses. The reason that you might need to have someone monitor those, which we look at every week, every other week, is if you have a partial response, it will not necessarily fire your email action. So you could have someone that provided enough information for you to investigate, but maybe not everything, and therefore you might not get that actual response. And of course, you see the disqualified down there, which if we get a partial and somebody didn't put any information in or they just typed gibberish because they were just seeing what the form had, we'll just mark it disqualified so it doesn't count towards our response counts. So earlier, when I said we had almost 800 people who've tried, because we have over 300 that we've disqualified over time as we've gone through this. One thing to note is when you click on that partial response, you can scroll to the bottom. That's number 807, the same as in the previous view. And you can hit refire action. And it'll then send the email to the places that you wanted to go. So if you have someone monitoring that, just looking for those partial responses on a long survey, you can still send the information in a very timely way. In the case of the foodborne illness, because that's where almost all our partial responses that get sent are, if they've provided contact information and name, we will send it along to our EPIs to call. Even if they didn't fill out the actual illness or the other sections, we will do that as follow-up because they took the time to go in at least that far. And maybe they just weren't feeling very well while they were filling it out. So we do have our EPIs still follow up, but you do want to hit that refire action and you do want to make sure that you do it for the right logic condition. So you see there's the copy of new send email and new send email. One of those goes to our epidemiologist, one of those goes to our environmental health clerks. And if you have multiple, you don't want to confuse the person getting it on the other end. Now, what those responses look like. So if we were receiving a food facility complaint, this is the PDF attached. I've blurred out information that might identify it, but usually these are pretty benign. They're part of the public record, so most of it's useful. But this is the PDF that Alchemer generated. The only thing we modified was possibly redacting some information for this presentation. So this person did write anonymous because they didn't want to identify themselves. And they were reporting a grocery store, I do believe. Tons of food and drinks that are expired, sometimes by months. They left pallets outside in the sun. They're not temperature controlled. I don't know if this person had insider knowledge saying, I don't believe they have food permits to sell what they're selling. This is what they gave us. They even gave us a Facebook page link and what to search for because they really wanted the store looked at. And the thing that is why you want to do that consideration for the file upload is they did attach these images down here. So our clerks can go to any of those images, and the PowerPoint is okay, and see what they attach. These are actual things that came from that particular complaint. where they're just pointing out these are the things that I thought were wrong. We sometimes, if any of you have seen a restaurant complaint for a kitchen that is not necessarily clean, some of those can get pretty gross. This is a pretty benign set of files that they uploaded, but they were pointing out that the expiration dates on most of these products were not good in this particular store. Okay. If we look at the foodborne illness, similarly, this person was the parent or legal guardian. They were reporting for another person. So we saw that section. Here's the sick individual's information. Um, they said they ate at a restaurant or food truck. This is kind of comical in a sympathetic way when you have someone who is sick with illness, but it's happened to them twice and they still keep going back. So it must be a really good Euro sandwich that they just can't get enough of and they just don't mind getting sick. But you can see they also indicated that two people ate and both people got sick. So our EPIs would have followed up with this as a possible foodborne outbreak. I don't know the outcome of this particular one. I probably should have looked that up before our presentation just for additional context. But um, this is how those PDFs come out. So that's why you also only want to show the questions that they answered. So you don't have a lot of information that you don't need, just muddying the water. And it just makes your life a lot easier. So where we go from here is our staff, especially on the environmental side, the clerks will take that report, they'll enter it into the health space database that our inspectors have access to. They will email them saying like, hey, there's a new complaint. They'll attach the pictures and the actual PDF that was generated from the email. And our inspectors will do what they need to, whether it's something that needs immediate attention or not. Part of our previous process is as complaints might come in, they might get put in an inspector's mailbox. And for any of you who may work in the sanitarian space, restaurant inspection space, you're not in the building all that often. So if a complaint goes to your mailbox, that's not a good timely response, or you don't, there's not the possibility of a timely response to it. In the same vein, for our epidemiologists, they'll get these complaints, they will start working on it. If it's something that needs to be notified to our environmental health, our communication protocol and that SOP says they need to send an email to the food inspector, food safety inspector, or food safety supervisor. There we go. And the clerical staff, and then they will make sure that the inspector gets it just the same as they received a complaint. A lot of times we also, I mean, a lot of times we find that we may get a single complaint, so not something that rises to the level of an outbreak, but it's something that's good to know for repeated habit because we definitely have facilities that are repeat offenders on things, but they might happen so far apart. And having this now as part of the record helps our sanitarians connect those dots in a way that they wouldn't have before if it came into a clerk and then came into an epi and then those three individuals never talked directly about the outcome. Okay. So I think that actually might be, oh, nope. There's one other thing I was going to show you, and that was the foodborne checklist. I think I may have pulled it up briefly before, but here it is again for those that you saw just as a tool, a little bit larger on screen. And then the final thing is we did some marketing when we first released the survey. The food safety supervisor and myself were asked to come on one of our local news stations. We gave an interview about it. I believe our PIO also put it out on Facebook at the time. So we did market it and we've had people using it. We're still in the process of diving into more of the data other than just the response. That was the first thing we wanted to get up, improving our communication, improving our response, and getting that QI team back together. The clerical staff, the sanitarians, the EPIs have all been very pleased with how this has worked out. They're all being notified much more consistently, much more completely about what's going on. And it's really helped improve cross-department operations in those different areas. So I will open it up to questions. Oh, go
Let's
back.
give Brandon a round of applause really quick for all of that information. Thank you so much. Brandon, one question that came up in the chat earlier was about that foodborne illness. I know you just shared it, that document that you had pulled up. I'm trying to, the guide Yeah, the checklist. Perfect. Is there any way that you could send me a copy of that and we could make that available to participants? Because we tried to find it online and I think we found something close to it.
Yeah, absolutely no problem. Um, yeah, again, as part of that, we met a whole bunch in that QI project team. So I don't remember how much we modified the original that we did find. But this was our final. So absolutely, we'll send that and get that out to whoever wants it.
Awesome. Thank you, Brandon. Any other questions? I see a comment from Christine. Fantastic work. I'd love to adopt this process in my health district. Yeah, it's a pretty robust process. Can't say I blame you.
Well, we appreciate that, Christine, and it's really easy in Alchemer to copy a survey and send it along. I know that the librarians have facilitated that. Um, I figured out how to do it too. You just have to change the owner. So if it's something that you want more timely or don't have a librarian yet in your area, just shoot me an email. Um, now I fearing getting like 50 emails. I don't know how many people are in our session, but oh, 75. Wow. Okay. So if you all send me emails at once, it may take a while to do that. So if you have librarians, that might be the best way, but I'm also happy to help as I can.
And if you have questions about who your librarian is, you can reach out to me and I can help you find out who that is. But the survey is in Alchemer. Like I said, Brandon came to one of our monthly Kansas meetings and shared about this survey. And I've had a handful of health departments make copies of it and use it for their own purposes. So it's a really, really well thought out survey. It's a good opportunity.
And I'll show you all from inside the survey since I think we have about 15 minutes left for questions or whatever. Is that right?
Yep, that's correct.
So looking at some of those things that I talked about, here's our first page in the back end. Here's our skip disqualify. It's really easy to select your question, to say this is the answer I want it to be based on, and skip to page 5 in this case, because that's name your pages, make your life easier as you do it. I guess we could have used if the logic passes, mark the response as complete or disqualified. We didn't play with that just because we knew there might be partial responses and didn't want to worry about that at the time. Okay, do all of our questions. And I'll show two. So this is an example of a group question. So custom group was the type. And then we have all these different sub questions that we were able to say, I want this to be a text box or an essay or a date or whatever it may be. There are some things, I think Slider doesn't work with it, but there are some things in there that can be very beneficial to group this way. If we were looking at this from a mobile perspective, I'll have to go through the first couple pages. Oh, there we go. So mobile, as you see here, only does one question. This was not inside a group, but I'm going to say another person. And now all these questions are. If these were not in a custom group and you were doing this on mobile, you would have to go one question at a time, screen by screen, advancing like this. And as I said before, that would drive me nuts. I'm sure it would drive a lot of people in the current uh, digital age quite insane to do that one at a time. And it would also make your percentage increments like 1% per question. So you're really going to frustrate people. So that is really the big advantage of doing that custom group to group the questions that are that need to be, so forth. Um,
Brandon, quick question.
well,
Can you
sure.
talk a little bit about what data looks like on the back end with the custom group? It shouldn't be too much different than if you were to ask each question individually, right?
It looks exactly like that. I'll actually go to our real survey and not the copy I made. Um, okay, foodborne, we'll do facility complaints. So this one also has, except for maybe the first, what type of complaint are you reporting? This was obviously food facility complaints. That's the first question. Skip past some things. Then we get down to primary complaint. Most of ours are in food handling, major facility issue being our second place. But then we go down to basically all the questions you're used to seeing. What was the issue? Describe what you saw. And that really doesn't impact, like it lists them just as if they were all individual, from what we've seen. So if you're using the Alchemer reports, it will list them just that way. You don't need to worry about any kind of weird thing. If you export it to a CSV, they'll all be in their own column. It doesn't bucket them in any other way. It just is a nice way to group them for presentation depending on what you're doing.
Awesome. Thank you for clarifying. I know
And
sometimes I've heard people are kind of afraid to use custom groups because they're not sure what it will look like on the back end. But yeah, that's helpful. Thanks.
well, I'm one of those curious types that I will just venture forward and see what happens sometimes. So your benefit, my sweat and tears, but that's how we grow in public health. You can also see for those who don't do it, we have multiple different reports down here. And you can set all of those. You just have to set a filter within them. So just our foodborne illness, just our food facility, everything together. And I made one for our disqualified just in case we'd ever want to go look at those again. But most of those are gibberish or blank.
And just to clarify, those are updated every time there's a new response to the survey. So all of your new data just goes within those reports already, right?
I believe so.
Yeah.
I don't look at those reports that often, to be honest. At least I haven't yet. I mainly go to individual when I'm looking for those partial responses and so forth. Um, which that's actually okay to do because just yeah, we're all pretty much caught up to date except that one partial that I left there for that screenshot I took. So you can see our disqualified ones. Even they answered restaurant food truck, but maybe they said nothing else. So that would have been the reason. And you can choose what columns you see here too for those who haven't, based on your questions. These two columns tell me right away which answer they chose. If there's a facility name, they did a food facility complaint. If there is a category here, it's a foodborne illness. But you can see we've had almost 800, 431 were marked complete. There's that one partial that I'll resolve soon, and then 347 disqualified ones. But that also, we feel that this also saves, we still get phone complaints from individuals as you're always going to, but this is definitely cut down on some of the things that we have to deal with on the phone because people are putting the information in there and we can address it as we need to in real time.
Awesome.
Oh,
Thanks. Any questions from the group? You're welcome to throw them in the chat. You can unmute. Up to you, but we've got 10 more minutes. Here's one. Is there a benefit to disqualify rather than delete responses? Good question.
I don't know that there's a direct benefit. I tend to treat that response data cautiously. I can always delete it later if we need to. At least as we started, I just went with the disqualify action rather than trash just to make sure that our processes are okay. I have had an instance where, I mean, you can go to the trash too for a certain period of time, but I have had an instance where the wrong option was clicked and we had to undo it. So I'm always just a little less paranoid if I can see the status rather than and it disappears and goes somewhere else. Okay, one thing I'll note too is if you're doing a longer survey, you might not see everything scrolling down in the edit pane. There's these pages down here, and sometimes this is showing us 1 through 5, which is it's really deceptive how it does it. And on page 6, we see all of our final things like our thank you page, our URL redirect, our send email actions, which again, I'll go through merge codes. So if I wanted to put a particular answer in here, I can go to that merge code button. I can say everything from page 1, everything from page 2, or you can just do specific questions. So if I click that, I can say, I want the question answered directly in the email, directly in the subject, whatever it is. You could actually put your whole survey directly in your email without needing a PDF. So if it's a sensitive survey, I wouldn't recommend that, but there's definitely cases where that may be the easiest way. And you can send it to as many emails as you want, but if you want different messages, then you just need a different send email action. That's very simple to do. action, choose URL redirect, send email. Some of these, depending on your account level, will be locked. You can see a lock there, uh, but there are a ton of options within Alchemer. I think we haven't used this yet, but we're going to soon. Yeah, the Google spreadsheet. So you can even push your data straight into a Google spreadsheet if you wanted it to be more publicly accessible without someone being able to get into the back end. So we have plans for that real soon, but we haven't used it yet. So I can't report on it.
Thanks,
Oh,
Brandon. Edward put a comment in the chat and then a question. So they said, I appreciate all this info. We've been talking about finding a way to utilize surveys for foodborne illness interviews within my jurisdiction. So this seems pretty timely for them. Then they ask, what are all the methods being utilized to get the survey? Currently, we're using Code Red to send the messages to confirmed cases in ODRS or odors, but that only gets to them if the phone number listed is a cell phone.
so as far as this survey, it's mainly passive. So typically, this is someone who got sick enough that they really wanted to leave a review. I mean, it's in an online culture, we mostly leave reviews when it's a negative one instead of a positive one. So we have this listed on two different web pages, both our infectious disease page and our foodborne food safety page. Um, we put it out, like I said, on social media, I think at least once at the beginning. And then we definitely did an interview just to make people aware. We get regular answers to this. I think, what was the average here? If I go back to results, I think it was a couple a day, average two a day. So yeah, been in the field for five. Well, there we go. That's an interesting little data metric there. So we've had pretty steady use of this, sometimes more than others, but um, as far as using these surveys, this or others, uh, to push out to people, we have done specialized surveys for weddings. We've had a couple large outbreaks at weddings in the recent past, that it was just easier to do this. We pushed it out to everybody. We got a decent enough response for one of them. The other wedding wanted to be as uncooperative as people can be. So unfortunately, we weren't able to do as much good follow-up there. And that was in addition to the traditional methods of trying to call, trying to get in touch with. Um, Being you mentioned odors, it means I know you're in Ohio. Um, you're right. If we don't have a cell phone, if we don't have an email, if we don't have some contact, you're going to have a hard time unless they were at a facility like a hospital, urgent care, where we might be able to get the partner to help us with that information. Oh, another feature that if you have not used it in Alchemer, highly recommend it. Alchemer has their own QR code generator. You don't need to pay for a QR code. You don't need to worry about them expiring. We've put this QR code in a couple places for this survey, and we've used it for a lot of other surveys too. There's no difference between small, medium, and large. I don't know why they give you an option. I've tried to test it. I've tried to find a difference. There's none, but you can download that. You can embed it. Very useful, depending on what you want to do with it. But
Yeah,
I encourage people to explore because, like I said, that's my mindset. Is if I see something, I'll push the button, and hopefully it's not a really bad button. So
yeah, there's lots of buttons like that that you can push in Alchemer too. We use the QR code button all the time in Kansas. We love that button.
one final
Any
just oh
Oh, go ahead. I was just going to do a last call for questions, but go ahead.
one final thing, if you haven't done this in your jurisdiction and you are using Alchemer, I really recommend you build your own theme so that you can apply it to your surveys. Um, if you're following public health accreditation standards, you need some branding on just about everything you do. But if you go to themes under the style tab and then your theme library, you can first customize, but you can save your theme here. And there are a bunch because there's a lot of departments in here, but we've done a couple different ones depending on our context, but ours is right there. Um, it saves time. You don't have to reformat every survey, but it also tells all your constituents that it's from you. Like it's very clear what's going on. Um, this is a single image just by way of best practices. Instead of two, we made a PNG with those together to center like that. But yeah, just play around and definitely include a style, include your branding, build that trust in public health.
I know we have a couple minutes, but I do have a quick question. Having worked in a health department and more on the epidemiology side, ha has that department or has that part of your group, have you guys used expanded this survey to reach or more towards the communicable disease investigations?
So could you elaborate a little bit more on
Have
what you
you,
mean?
yeah, so has like the epi team or has the survey been used for any other communicable diseases or for any other for a difference approach rather than just the food and safety illness reporting?
We haven't used this survey for that. We did discuss it while we were doing this process, and um, since it was QI, we decided to limit our scope, to make it a successful QI project rather than trying to throw everything under the sun into it. We do have several other surveys for collecting line lists from our long-term care facilities, from our school partners. And that's really useful because we can put the template we want them to use right in the survey for them to download. Then they fill it out, they upload it through that file upload section, and it's sent to us securely. So we've done that kind of use of different surveys for collecting that information. So you don't have to worry about encrypting emails or how they're going to fax you the information or them writing it on a piece of paper and trying to get that to you some way. Um, but that's probably the two main applications we've used for managing communicable diseases.
Awesome. Thank you.
Information transfer primarily.
All right. I don't see any other questions in the chat, and we are just about at time. So I want to thank Brandon again for joining us today and sharing so much about this survey. It is such a good survey, and what a good process you went through to build it. So thank you again for jumping in and sharing more about that. We appreciate it.